Good afternoon, Dialysis Patient Citizens Educational Center. This is Dr. Velma Scantlebury, and I am here with you live this third Wednesday of the month, and it's November 19th. And I'm here to talk to you with about anything you have on your mind concerning dialysis and transplantation. I do have some expertise, but I don't know everything, so we'll discuss whatever your topics are. So welcome, Nancy. Thank you for coming on, and I hope we have a robust conversation again today as we head into our Thanksgiving holiday and the fall to winter season. And we know for many, this is a time where many folks don't want to be alone and can also be suffering from depression as folks are gathering with friends and family. Let's remember all those who may be able to reach out to, if it's a lonely neighbor or someone sitting in the chair on dialysis next to you who just need a few words of encouragement. So let's do what we can to encourage others during this season, as many of us have so much to be thankful for. And Thanksgiving is just, even though we celebrate it and in November, it's really about recognizing all of our blessings. And so we appreciate so many of you who are here and who support each other. And we know that having kidney disease is often for many very challenging. For some it comes as a surprise, and it's often difficult to deal with. And without knowing that kidney disease has no symptoms, many people are diagnosed with kidney disease, and so many more are diagnosed with the need for dialysis without knowing that they were headed in that direction. And so that can be a really overwhelming change for life in your own lifestyles. Now you are committed to, or having to commit to some kind of treatment, whether it's dialysis or knowing that you will end up on dialysis. And so there can be a lot of up and downs when you have this sudden diagnosis. It's, for many patients who may have polycystic kidney disease, they may know that others in their family had a need for a transplant, and they may expect that. But when you're least expecting or never predicted you will be on dialysis or that you would need a kidney transplant, then it can be overwhelming. And so for people who are waiting for a kidney transplant, you wait anxiously. You never know when that call is going to be made. Many people get disappointed. For some patients, it may be years before they get called for a kidney transplant. And Alethea said I was called for a kidney, and they told me to come to the hospital, but they said it was 4 people for 2 organs. Explain the process. Well, generally when we as a transplant center, when they get an offer for a kidney transplant, unless you are the only center within that region, oftentimes you're going to be sharing that list with a center within your own network. So you may have 2 or 3 transplant centers sharing the same pool of kidneys. Or if you're a large hospital and have a lot of patients on your list, then you may have, if depending on the blood type, you may have multiple patients. And how it works is that if you are on the list for a kidney yesterday, if you're on the list for a kidney alone, then and there's a child ahead of you, as an adult, the child is going to get priority. Anyone with double organs is going to get priority also. So if someone is waiting for a liver and a kidney, they get priority for that kidney to go with the liver. If there's a patient who was a prior donor and donated a kidney and they're on the list, they get preference to you also. And so if you have someone who have high antibody levels and they're 100% antibody level, they get extra points. So they're also going to be ahead of you also. So those are the things that come into play. You may, and so you may be number 2 or number 4 in the list, but another center may have 1 and 2. And so you're waiting to see if those patients are doable. Oftentimes patients will come in and they have an infection. They come in and they haven't completed a cardiac cath, and now there's an abnormality and it gets canceled, and it falls to the next person. What the surgeon will do is they want you to be aware that you may get called, and so you are asked to not eat anything, to stand by to see if that kidney will then be passed on to you. So thank you for asking that question. Again, I'm Dr. Velma Scantlebury. I'm here with questions and answers at Dialysis Patient Citizens Educational Center. And now you said I'm in Michigan and was flying to DC. And so it's important to realize that oftentimes that you can get that call, and I may call a patient in and for a kidney transplant, and that kidney was offered to me. I wasn't there to retrieve it. It was retrieved by someone else, and so it's sent to my center, and my patient is in, and I go to the operating room to look at that kidney, and suddenly there's something wrong with that kidney. During the process of retrieving it, someone cut an artery or the vein, something is missing, the ureter is too short, or there may be a abnormal lesion in that kidney that I now biopsy and decide that there is a potential for cancer, and I decide not to use that kidney, and so patients are disappointed and they go back home. But remember, it's a process, and the goal is to do no harm. Our goal is to make sure that you get a kidney that's functionable, and even times if there's such a thing as what we call donation after cardiac death, or where a kidney may have ATN, acute tubular necrosis, meaning that the donor died with low blood pressure, maybe didn't make urine immediately, but we know the kidney will wake up soon. And oftentimes we'll put those kidneys in and tell the patient it's a good kidney, but we know it's not going to make urine for a day or two. And so it's important to realize that, yes, I may need to dialyze you, but if this donor is very young and healthy and didn't have blood pressure issues or diabetes or any other overwhelming issues, and it was just a matter of volume, and now the kidney is going to recover, then that kidney will soon open up. It may take a few days, it may take a day, or it may take a week. During the process, we will dialyze you to get you to that point, because during surgery, we are also adding a whole lot of fluid to you, and post-op, we're trying to give you a whole lot of antibiotics and medications, your immunosuppression, and so you can get volume overloaded. And so it's important to not challenge your heart, but to also dialyze you during those times. So great process, great question. Just remember that as was said there, that each call leads to the call, and that's one thing to remember. That oftentimes some patients will say, "Well, I got a call 10 times before I finally got the call that I ended up with the kidney," and so it can be disappointing. You wish that each one was that one, but I think, and just remember, the kidney that's marked for you is the one you're going to get, and we always have to make sure that there's sometimes you will have days where we have a lot of kidneys, and then we'll have a spell when there's no kidneys, and so we have to be really cognizant about the fact somebody's given the gift of life, and except for that ability to want to help others, we will not have organ donation. So we have to remember that there's a family suffering on the other side of this, but during that suffering, they are also willing to save a life by agreeing to organ donation. The surgeon was adamant about getting on the plane, but said we lost the kidney to someone else. I don't think it was, but another life was saved. So thank you so much. I appreciate your willingness to be so compassionate. And it's really, just remember, this call is going to lead to another call that's leading to another call, as said. And so it's important to realize that oftentimes the goal is not to waste a kidney. and we want to make sure that it's always a backup. And so as some patients will say, you know, I'm constantly being the bridesmaid, but never the bride. Each donor is going to be different because of the genetic makeup. So the list of people who are at the top may change every time the genetic makeup of the donor changes. And it depends on how many people have a certain amount of points, what's your antibody level, and who will go first, second, third, depending on so many other different factors. So what should people who are preparing for the holiday meal keep in mind, family and friends, and that may be on end-stage renal disease patients? Share with their hosts about their needs and expectations, and be aware and plan for everyone. Any suggestions? Definitely we want to be, as we move into the holidays, if you're not making your own meal and you're going to someone else, if you're on dialysis, you want to often be cognizant of, if you're missing a day or you're being dialyzed, you're not being dialyzed on Friday or Saturday, which you probably should. For some people, they're going into dialysis, but you want to be careful with your fluid volume. As you sit around and eat and drink, just remember that there's also fluid in your foods. There's fluid in the gravy, there's fluid in the cranberry sauce. Everything has extra fluid with it as well. So you want to not go overboard with the fluid. You want to be careful with certainly with potassium-containing foods, the potatoes, the mashed potatoes, those kind of things, and try to be cognizant of being small portions. You want to try everything. You want to enjoy yourself, but you also want to make sure that if you're going someplace else other than home, please take your medications with you. Make sure you have extra medications if you're going to be on the road or traveling far away. Take your blood pressure cuff. Take your glucose meter if you're diabetic, so you don't want to get where you are and realize, now I've left my heart medicine behind. Make sure those are things you pack and put it in your purse or your carry-on so that you have them with you all the time. Always have your medicines with you, and when you pack, even I tell people from day to day, make sure you have a little container with your medicine in case you get stranded anywhere. So that's very important, and also making sure that if you're not going to be dialyzed the next day and you have 2 days to wait, that you also be cognizant of the fact that small things may put you into congestive heart failure, especially if you have underlying heart disease. Things that are salty, ham, pepperoni, lots of cheese, those things, although, as you're on dialysis, you should avoid dairy foods, but you may want to have a small amount, but make sure you take your phosphorus binders. And you may have to take some extra to make sure those things are, if you want to have enjoy in small portions. But the biggest thing is making sure that if you develop symptoms of shortness of breath, difficulty breathing, that you make someone aware. You may need to go to urgent care or make your doctors aware, but you do not want to go above board so that becomes an issue when you're not home. And if you are unable to wait to the next day to get dialyzed, because if you're not urinating, there's nothing they can do. Lasix or diuretics is not going to work to get your extra fluid off. The only thing is going to be dialysis. If you had a kidney transplant, certainly your kidney is functioning to any degree, you may be able to get away with some diuretics that will help you urinate more, and some potassium binders to bring down your potassium. But as she said, high potassium, you got to be careful, look at your menu, decide how much of what you can have, try to calculate what a portion and how much potassium is in that portion, and also think about what you're drinking and the volume you're drinking, and keep track of that as well. So thanks for that question. You want to have a good holiday, but you don't want to end up being hospitalized. So thank you so much. We are in the season. I just read something about having a new, more potent strain of COVID. So make sure that if you are immunosuppressed and you're not, you've had a transplant, you're not within that 3 months of post-transplant where your body will not react to any vaccines whatsoever, that you get vaccinated unless you have a contraindication such as a reaction or advised by your doctor not to. So it becomes very important to get your flu vaccine as well as your COVID vaccine so that you stay healthy during the season. And also just remember, we are not totally, the goal of the vaccine is to keep us from getting hospitalized and keep us from dying from COVID. The goal is you may catch COVID, but you want to have those antibodies so that you can have some defense against them. And while you may be immunocompromised being on dialysis or having a kidney transplant, even if you get 30% antibody formation, it's still better than 0%. So I appreciate those of you who have gotten vaccinated. We are already into mid-November, so hopefully you should have gotten your vaccines. But also not you, but encourage your family members, because you also want them to protect you. And you don't want them to be sick because you don't want them to also cause you to develop a more severe illness than you're likely to do. You would bring a kidney-friendly meal for people to share. That's a great idea. I mean, you can make, there are many dishes, many recipes, I should say, on the DPC website of things you can make that are low potassium and are enjoyable. Remember, most of your vegetable dishes are excellent. Stay away from things that are high in dairy, like we all love our mac and cheese, but it can be deadly when it comes to that cheese. And you want to be able to make sure that you don't suffer the consequence of just one day of celebration, because, you know, we have the rest of the week and we also have Christmas in December to deal with. So appreciate that advice there in terms of bringing something that others can enjoy and that you can have, you know, that you can have. So thank you so much. Any other questions? I think Nancy had asked about long COVID. There are many patients who, I actually saw a patient recently who still has not gotten her taste back. And so that some people are suffering from fatigue, that is long-term. I see quite a few patients who, based on discussions with our rheumatologist, who have some, maybe a little component of an autoimmune disease that may be related to COVID infections, repeated COVID infections. So you want to be careful that, especially those patients who have COVID that is very severe, if you know anyone that have COVID, make sure you tell them to call their physician so that they can call in Paxlovid or the antiviral treatment so that you can prevent the severity of the illness. There's now a treatment for that. Get vaccinated, but you also want to get those medications in your system within 3 days of knowing that. So reach out to your healthcare provider so that they can call that into your pharmacy, even if it's a Sunday afternoon or at least a Monday morning, so that you can get on that treatment regimen as soon as possible. Appreciate moderation has kept my phosphorus and potassium down. I know there are many patients who struggle with keeping their phosphorus down. They say they're doing everything that they can. They're avoiding the foods and they still have phosphorus out of control, and the potassium. So you oftentimes it's nice to write a list down of the things you're eating so you can do a little bit of research. Know that cranberries are bad for you, so so you want to stay away from things that you may not know have high potassium and phosphorus. So make sure you take your binders. Make sure you may need to take extra binders, or if they're not working for you, there are other medications out there that can help bring your phosphorus down, because that's such a detriment, because what that does is it ends up depositing in your blood vessels. And so after years of having abnormal phosphorus levels, it can have that deposition in your family in your arteries and cause issues with getting that transplant. Is there a limit to how many lists you can get on for transplantation? I assume that you're talking about listing at various centers. No, there's not. It just depends on how much money you have to be able to get around to many centers to get on as many lists. Just remember that if you are within a certain area, the list for your OPO may be shared amounts many different transplant centers. Like for instance, here in Delaware, Philadelphia is close and we share the same pool of kidneys. So getting on Delaware's list is, and UPenn, University of Penn or Temple is while you can, you have to choose one center to get transplanted at because you're picking from the same pool. Now, if you choose a different pool, or I go to New Jersey and you're able to get there and you're willing to relocate there within the first few weeks after a transplant, then you can list in that area. Generally, I tell people if you want to be listed in North Carolina, make sure that there's family members or someone who is going to be there to support you and help you in another state or a different location outside, and that you're able to have someone who could drive you back and forth when you're unable to drive immediately post-transplant. So yes, you can get as many lists. Generally, one transplant center can transfer much of your workup to another transplant center who is outside of a different area or within a catchment area, a different OPO. But each center will probably do their own blood type and antibody testing. So all that's paid for from Medicare, so it's not an issue. And so yes, it boils down to, can you get there when they call you? And how will you, and who would help you when you are in that location and who is going to be your support system? Numbness in dialysis patients in the hands, how do we get past and what causes it? It all depends on, sometimes the numbness can be due to blood supply to your hands and where your fistula or your graft is. Sometimes it can be a steal of blood to your hand, especially if you have an AV fistula. Generally, we have artery and a vein, on both sides, one's bigger than the other. But oftentimes, remember, when you create that fistula, you're stealing blood away from your hand because, and so some patients will have much more of numbness because of lack of blood supply or to the hand. There's some patients, a few patients who have had to have it reversed because they did not have a second artery or the second artery to the hand was not adequate enough. When you make that fistula, what's important is that the vein is small and the connection, the outflow has to be proportionate so that you're not stealing all the blood from your hand to that dialysis access. So that's generally due to issues of blood supply based on whether you're on your fistula or your graft and what size they used for that. So thank you very much for that question. Yeah, let's see. I was listed in 3 places: Jefferson Hospital, Pittsburgh, and Chicago. I was transplanted. Okay, so those are VA hospitals that make it possible for you to be listed in different places. I almost think Pittsburgh, PA, that's where I was trained, and I was transplanted October 26th. Oh, wonderful, congratulations. Hope you're doing well and recovering. October, you're not even a month out, so congratulations. How long have you been listed? But I'm glad you were able to get transplanted. And where did you get transplanted? It says in October, but maybe Chicago, but let me know. Thank you very much for sharing that wonderful news. Andre, congratulations to you. I'm assuming you're still being monitored closely, going back every week, and hopefully, if this was a deceased donor, I hope the kidney is working well. If it's a living donor, I'm sure it's probably is doing well also. So thank you very much for sharing that. And if there are any other new transplant persons, let me know. Let me go back, make sure I didn't miss anything. But like I said, we are coming up here about 6 minutes left, and there's numbness in the hand. So I think I got most of the questions. Definitely moderation. The big thing also is is if not only your phosphorus and your potassium, but you also want to watch your blood pressure as well in terms of controlling your blood pressure. If your blood pressure goes up and is high, generally when you're not on dialysis, certainly taking into consideration that salt in many of the foods. You know, cheese has a lot of salt. You want to avoid the ham. And especially if you're diabetic, please stay away from those marshmallows on the sweet potatoes. And because that you don't want to go into diabetic ketoacidosis by having too much blood sugar. Remember to take your insulin. Remember to take your pens if you have them. Pack your little your diabetic supplies with you so you can always have them with you. That is one thing you do not want to forget, your insulin. If you're traveling to a hot climate or you're in a hot climate, you can have one of those insulated little containers where you put an ice pack to keep your medications nice and cool. So be cognizant of your blood sugar, be cognizant of your blood pressure, what you're eating and drinking, your volume, making sure you avoid congestive heart failure, and that can also be brought on by too much salt, so that's one thing to consider. And as we said before, phosphorus and potassium, those are the biggest culprits when it comes to any holiday meal, especially during these times. And for many of you who know others who may be not have any family or friends or anyone close by, be sure to see if there's any way you can include them, bring them along, or bring them something to eat, drop off. If you know any elderly people who may be all alone, be sure to take them a plate. If you live in a vicinity where there are others who are less fortunate, we know that these are times where we're paying a lot more for food. There's so many more who cannot afford to buy or even feed their family, and there's a lot of those in need, and so much of the funds for children and families have been cut. So if we have any way of helping others, especially during this holiday season, or even being able to to lift someone up despite our own issues, despite our own problems that we're facing, it's often good to pass, say, a nice word or a word of cheer to someone who may be alone and need a little bit of help. So that's my advice for if you have any opportunity to serve your church or a food bank to help out, be sure to do that if you're capable and able to do so. So I appreciate all of you guys being here. We have 2 more minutes. Let's see if you have any more questions. I think I covered all of them. I hope that you will enjoy the holiday season coming up, and try to do your best to realize that there's light at the end of the tunnel if you're still waiting for your transplant. Those who, as you see, be encouraged by those who got transplanted after many years. And if you're in the process of being worked up and not being able to get through the test, know that with some help, maybe reach out to family members who can help you complete those testing. If you are on the list and don't know whether you're active or inactive, please reach out to your coordinator. Find out if you are actively listed, because if you're missing one test that you can easily complete so you can become actively listed, that's something you need to do that they may not have brought to your attention. Maybe you just need to get your dental clearance, or you forgot to pass along your report from they didn't follow up on your sleep study. So always keep in check with your transplant coordinator if you're listed, and if you're listed, verify that you are on the active list so that you are not missing calls. And so that's one thing many patients do not understand, active from inactive, as they're waiting for you to complete some kind of test or some kind of study. So that becomes very important. So I appreciate all of you being here today. We are a week and a day away from Thanksgiving. Enjoy your holiday. Spend time with your friends and family if you're able to, but if you're not and you're a loner, enjoy your time alone, watch your game, reach out to friends, and have a wonderful weekend. Thank you so much.